Hi friends, I am Dr. Tanveer Abdul Majeed. I am a surgical oncologist trained at Tata Memorial Hospital. I specialize in thoracic, GI and HPB surgery. Today I am going to talk about esophageal cancers. Esophageal cancers, as we know, is one of the most important cancers. It actually is ranking among 1/6 of cancers all over the world. Because of the location of the esophagus and its proximity to various vital structures in the chest and the abdomen, it is actually difficult to treat. Esophageal cancers are actually treated by various methods. It is not only a surgical approach, it is a joint surgical approach of surgical oncologist, medical oncologist and radiation oncologist. The most common etiological factor or the cause of esophageal cancer, there are two types. So the first cause for adenocarcinoma gastroesophageal junction or of the esophagus is gastroesophageal reflux disease. Squamous carcinoma is more common in people who have tobacco consumption and smoking. There are various predisposing factors and genetic conditions which predispose to the development of esophageal cancers, but they are beyond the perspective of this talk. The most important investigation what we do for diagnosis of an esophageal cancer is upper GI endoscopy, where you can get a biopsy, you can actually map out the disease. Esophageal cancer patients present with dysphagia in swallowing, means they have a problem in swallowing solid foods, and over a period of time this goes on increasing, and at the advanced stage they are not able to even swallow liquid. So it is called as progressive dysphagia. So in patients where there is a dysphagia which is persistent, the most important outpatient investigations is an upper GI endoscopy. Once you have done an upper GI endoscopy, and if there is an esophageal lesion, it is biopsied for histopathology and also molecular markers to contemplate further targeted and immunotherapy. The second most important investigation for esophageal cancer is contrast enhanced CT scan of the thorax and abdomen. This not only actually defines the extent of esophageal cancer involvement, but also actually depicts the correct relationship between the esophageal cancer and the trachea, that is the windpipe, the descending aorta, thoracic aorta, the heart, the pericardium. So a complete mediastinal and abdominal evaluation is done using a contrast enhanced CT scan. Recently there has been an addition of whole body PET scan to actually localize or actually stage the metastatic disease which may be there in the lungs or liver or bone. Once the diagnosis is made of esophageal cancer, based on the stage of the disease, patient is evaluated in a multidisciplinary team which consists of surgical oncologist, a medical oncologist and a radiation oncologist, and the most appropriate treatment is actually tailored for that patient. We all know that esophageal cancers involve surgery which may actually be associated with opening of chest, which is a morbid procedure. So with patients who have got borderline functions, we actually use minimally invasive surgery for esophageal cancer for mobilization in the thorax. Recently there has been increase in robotic surgery for esophageal cancer, which not only actually improves the outcome, the cosmetic outcome, the physical pain score and ventilatory days of esophageal cancer patients, but leads to a faster recovery and thus actually cuts down the cost of treatment. If the esophageal cancer is locally advanced, the most important treatment is neoadjuvant therapy, which may consist of neoadjuvant chemoradiation or chemotherapy, which is FLOTS regime. Once this neoadjuvant treatment is done, patient is re-evaluated with an endoscopy and a PET CT or a contrast enhanced CT, and surgery is contemplated. Post-operative, these patients usually do well. The normal time span which they stay in the hospital is about 2 weeks, and with minimally invasive surgery it is actually lesser. What are the most important symptoms of esophageal cancer, which one we should be actually aware? Patients who have long-standing gastroesophageal disease, reflux disease, that we call as heartburn, acidity, where you feel that the food or the acid is coming into your mouth, these patients should subject subject themselves to an early endoscopy, which is actually evolved over a period of time, and it also actually diagnoses very early lesion with the advent of narrow band imaging techniques which our endoscopists do. Patients who have GE junction Barrett's esophagus because of a reflux disease, with expert's hand they can undergo endomucosal resection instead of a major morbid procedure like esophagectomy. Most important cause for any cancer is early diagnosis and prevention. So for prevention of esophageal cancer, the most important thing is elective endoscopy, as the people in Japan actually they subject themselves to elective endoscopies, and earliest lesions are diagnosed, they are biopsied, and if the lesions are early they can be resected endomucosally. After all, the story is not as grim as it was few decades ago. There have been a lot of improvements in surgical techniques, advancement and use of surgical staplers, use of neoadjuvant treatment. So with this we have a very important message for our patients. Show yourself to a specialist if any of the symptoms of reflux esophagitis, heartburn or difficulty in swallowing persist. The most important treatment plan is early diagnosis, early treatment of esophageal cancers, and to this we can add prevention. Prevention is better than cure, because if you are able to prevent a disease, the outcome is much better than curing, because when you are curing a patient, you have to subject for treatment. Now, esophageal cancers can be well prevented by adopting a healthy lifestyle, actually decrease consumption of aerated waters, decrease intake of hot tea or spicy food. At the same time, if your symptoms of heartburn or acidity or reflux or dysphagia is persistent, you need to consult your doctor at the earliest so that he can diagnose a disease at an earlier stage, and that will actually affect and give a better outcome in terms of long-term survival and disease-free survival and overall cure. Thank you very much.